Selinexor has a unique mechanism of action. It's licensed in combination with dexamethasone for patients who have received at least 4 prior lines of therapy, again, exposed to the same agents that we have just mentioned, so PI, IMiD, and monoclonal antibodies targeting CD38. So this is a late-line indication. There's also an early-line indication, so 1 prior line of therapy in patients that were exposed to lenalidomide at least, in combination with a proteasome inhibitor and dexamethasone. So the use, of course, is very different. In late lines, Selinexor can be a rescue agent after we've used and exhausted immunotherapies, for example. Can be used as a bridge for CAR T-cell therapy in patients that have exhausted, again, other agents that have received already PI, IMiD, monoclonal antibodies. In the upfront setting, in the early lines, after initial treatment instead, a combination with a PI could be particularly appealing for patients relapsing after a PI-naive combinations. We know that the standard of care, for example, for all the patients now is a combination of IMiD, lenalidomide, dex, and dara. And so those patients are PI-naive. We do have some PI-based combination with carfilzomib or with bortezomib again. So I think some of these patients may benefit from the addition of Selinexor as well, that provides a different mechanisms of action from, for example, pomalidomide, which is again combined with bortezomib or carfilzomib. Safety-wise, I think that we all know that Selinexor has this safety profile characterized by gastrointestinal toxicity, decrease in appetite, nausea, and also fatigue. We know that in the combination with bortezomib, the dose is 100 milligram weekly with weekly bortezomib. We also know that those reductions may not impact significantly the efficacy of Selinexor while reducing the toxicity. So you can start at 100 with a low bar for reducing Selinexor, or you can start with a reduced dose and then increase according to patient's tolerability. It's important to remark the anti-emetic prophylaxis that is very important, particularly in the first cycles, to mitigate the nausea and allow patients to maintain their weight and also to stay on treatment.